we will be talking about the ins and outs of feline lower urinary tract obstructions, and we'll be talking about a whole range of things. I'm going to be talking about what's in a title. There's so many names bandied about with regards to urinary tract obstruction, so we're going to talk a little bit about that. We're going to talk about the statistics of these patients, the pathophysiology of things, the signalment or the prevalence of these cases, diagnosis, treatment, catheter selection, and being able to place it safely. Also talking about the nursing care and the home care as well. So, by incorporating all these things, we can really provide the most, the highest level of care for these patients. So when we talk about what's in a title, so, there's feline neurological syndrome, there's feline lower urinary tract disease, there's, lower urinary tract signs, there's FIC, which is feline idiopathic cystitis, some people might even call it lazy fat cat syndrome, okay? So, all of these syndromes or titles all pretty much describe a disorder which affects the urinary bladder or the urethra of cats. Some of them have functional obstructions, and some of them have mechanical obstructions in the lower urinary tract, and we'll talk about this now. So when we talk about these different titles, and these obstructions, we can have obstructions because of inflammation, we can have obstructions because of plugs or stones, we can have neoplasia, we can have cystic calculi, and we can also have neurogenic diseases which cause an obstruction. So in any of our patients, these can be because of an individual component of these, or because of multiples of them occurring at the one time. So when we talk about mechanical versus functional obstructions, mechanicals are our, there's a physical obstruction that's, blocking the pathway of the urethra, of the ureter, that's causing, no urine to flow down. So these are stones, these are plugs, these are cystic calculi, and this can be neoplasia as well. When we're talking about a functional obstruction, this is when we've got, issues that aren't actually obscuring it, but because of swelling or because of a stricture or because of neurogenic diseases such as spinal disorders, so hit by cars that have, lower motor neuron and upper motor neuron bladder, this can cause then a functional obstruction. Okay. So when we talk about our statistics, so we know that 2/3 of cats under the age of 10 that are diagnosed with fluted are often idiopathic. Okay, so we don't know the underlying cause of them. So these are often our FICs, our inflammatory cases, our cystitis cases that we don't know why it's obstructing it. Okay. So when we're talking about our fluted patients, so tonight we're really going to be, I'm really going to be focusing on our mechanical obstructions, so predominantly our plugs and our stones. Okay, so the studies that have been shown is that we're looking at about 4.6% of cases that are seen in general practice are cats that have feline lower urinary tract signs. Okay.